Hello, my name is Andrea Bates. I am one of the project managers within the Quality Improvement Department with IPRO's End-Stage Renal Disease Network program. And welcome to part 2 of the series, Breaking Down the 8 Dimensions of Patient-Centered Care. This series is broken down into 4 modules where we will review each dimension or area 2 at a time. Each module will consist of the following: 3 main points, sample conversations, and focus resources for each area. So a little review about the development of the 8 dimensions. They came out of research from Harvard on behalf of the Pickler Institute. Studies were done on a broad range of patients and healthcare teams providers asking what they considered to be the most important aspects of a patient's care. The results were then grouped into clusters or 8 areas, which patients and providers indicated would affect the overall experience of care. And every principle which we will discuss can be applied in some way to the ESRD community and creating a patient's life plan. So the 8 dimensions are patient preference, coordination of care, information and education, physical comfort, emotional support, family and friends, continuity and transition, and access to care. And for this second module, we will be covering coordination of care and family and friends. This slide just gives you an idea of where we are as far as the breakdown and what will be coming in the next 2 months and for the last 2 modules. So when discussing coordination of care, here are the 3 points to think about or consider when working with your patients. It includes generating referrals to outside agencies, whether that be home health care, mental health services, transportation, assistance with food supply, assisting the patient and family with coordinating these services to reduce stress and burden on the patient. Lastly, include additional support services in the patient's life plan. It can help reduce feelings of anxiety and vulnerability. So here's a sample conversation that may have to do with coordination of care, and maybe these are some things that patients and or family have brought up to you in the past. So you have a patient who's just been out of the hospital and their family member approaches you. My mother was discharged home from the hospital last week and is having a hard time adjusting. I think she could use some type of assistance at home, but we have no clue where to start. She has been so anxious. I'm sure if you are a facility nurse or social worker, this is a conversation that you have heard quite maybe frequently or something that you are used to. So the staff, which could be anyone, the social worker, the nurse, will say, I will speak with your mom today during treatment. What type of assistance are the both of you looking for? She, being the patient says, she mentioned to me having a home health aide and some PT come to her home as well as some transportation to and from dialysis until she is able to drive again. Those are referrals I can look into and discuss further with your mother. We can also discuss her goals with improving her quality of life and regaining her independence. So this is just an example of a conversation. Um, very status quo. Patient was maybe discharged from an extended hospitalization and may need some additional services until she gains her strength back or gains her independence back. So, for the fourth dimension, which is family and friends, here are three things or a couple points to consider. As we know, family may not always show up as blood relatives. Take note that patients could have friends who they refer to as family. Encourage the patient to include these individuals in creating their life plan if they're interested. It is not required, but having additional people may help you develop a more inclusive plan of care. And as part of the life plan, update the patient's emergency contact list on an annual basis at a minimum to keep it current. Have the patient re-sign and date forms as needed. This last point, I believe, is something that can be overlooked at times. However, um, people's life changes, they may have some life-changing events, and making sure that your facility has the correct people to contact is very imperative. Also, on the opposite end of the spectrum, it's important to remove people that maybe the patient doesn't want you to contact anymore. When talking about support from family and friends, a sample conversation may look something like this. Staff approaches the patient to say, your annual plan of care is coming up. Are there any family you would like to invite to review your life plan? We can set up some additional time outside of dialysis if you would like. And the patient may say to you, most of my family lives out of town, which is not unusual. We've come across patients like that in the past. So they say, would it be okay if I asked one of my friends from my church to come? We are very close and they help me out whenever I need something. It's always important for staff to try to accommodate the patient to their needs as best as possible. So staff could say or may say, yes, the friend can come to the care plan meeting. If they're not able to join in person, they can always conference in. And while we're at it, we will update your emergency contact list. There are several ways that we know for patients and family or friends to be involved in a care plan. It's not always convenient for them to have the meeting before or after, especially if there's transportation. So, to offer suggestions and options such as conferencing in, Zoom, or WebEx can help everyone's needs be met. Then the patient may respond and close out the conversation by saying, thank you for understanding. I will let my friend know about the meeting so they can join. It is important to me to keep them in the loop about my dialysis. So here are a few resources to consider specifically when working with these two dimensions with coordination of care and family and friends. The Kidney Fund, or I'm sorry, the American Kidney Fund, which is at kidneyfund.org, has a first 30 checklist. So this is really good for brand new patients. It is a two-page checklist that has to do with the first 30 days of dialysis. And it's for patients to use as a guide for maybe asking questions or inquiring about certain things. As we know, those first 30 days can be very, very overwhelming. So this just is something that the American Kidney Fund has for patients to use just as a guide if they need to. They also have a short video on their website that talks about the importance of family support and how it can have a positive impact when the patient has a support system. It may not be family, it could be friends, it could be people from their church, it could be neighbors, but it does talk about how having support systems improve the patient's quality of life. The National Coordinating Center, NCC, also has a tip sheet for caregivers and family members about finding balance and improving their quality of life. Um, I think it's very important too that caregivers practice self-care as well as the patients. And lastly, there is an ESRD patient emergency contact. This is a template that's already put together that patients can fill in all their pertinent contact information if there was an emergency. So this isn't just their emergency contact people, it has maybe what hospital they usually go to, medications that they're on. This is great as your facility makes sure that they had their emergency toolkit all prepared in case of any type of emergency. So that concludes module 2 of the breaking down the 8 dimensions of patient-centered care. Thank you very much, and I look forward to presenting on the October topic.